All right, so this section is safety and compliance. Safety for you, safety for the patients, compliance by the facilities. There's a lot of organizations that are out there making sure that we practice safely for the public, and one of them is the OSHA, the Occupational Safety and Health Administration. You have also a Joint Commission. You have the National Institute for Occupational Safety. So there's agencies out there looking out for our safety. So what is OSHA? I just said what it was. What do you need to adhere to the regulations? Well, again, they make sure, or they require employers to make sure that they provide the equipment necessary for you to perform your job safely. Okay, in this case, you're a phlebotomist. You have to make sure that you have gloves, obviously, right? We need gloves. We cannot perform a venipuncture without gloves. They require them to have those engineering controls or safety features on the devices. The employer must provide the safest equipment available for you to minimize the risk of getting punctured. So again, OSHA does a lot of things as far as safety is concerned for the employees, and they go out there and they visit employers, making sure they are adhering to the rules. Like in this case with the COVID-19, a lot of facilities were not providing the right PPE for their employees, and that was unsafe. A lot of people ended up quitting their jobs because they didn't feel safe. And again, that OSHA is supposed to be protecting us. What is the National Institute for Occupational Safety and Health and the CDC? The National Institute for Occupational Safety is a branch of the CDC. The Center for Disease Control is the agency that is out there studying, infections, viruses, everything that is out there that might be causing pandemics like the one we're going through. And the National Institute for Occupational Safety is the branch of the CDC that is out there to, again, ensure that the employers are offering safe equipment, but they study more, they focus more on, for example, needle sticks, okay? On needle sticks, how many people are getting stuck, how many people are getting injured or having complications because, they're phlebotomists. So that's what the NEOSH does. And again, they're just a branch of the CDC. So they're the ones that might be visiting the facilities and asking them about their needle stick logs or records. What operational standards proposed by Joint Commission, CLSI, and CAP, and why should you adhere to the standard? Well, Joint Commission, they remember from Chapter 2, is a big agency. They're a nonprofit agency that go out there and study the practices of every facility, not just laboratories, but hospitals in general. Every part of the hospital can be inspected by Joint Commission. And they go out there and, the visits are actually voluntary. Facilities have to ask Joint Commission to come and inspect them, of course, for a fee, right? And then Joint Commission will give them guidelines, okay? For example, the National Patient Safety Goals. They come up with these about every 5 years or so, and they come up with these based on the outcomes of hospital records. For example, there's a National Patient Safety Goal on patient identification. Okay, why do they make it a national? Why do they make it a big deal, right? Well, because there's a lot of errors that occur by simply not identifying the person correctly. So they asked, the laboratories or CLSI, make sure that every person is identifying using at least 2 identifiers, and make sure that the person is involved in the procedure. Okay, so you cannot say their name, you ask them their name, they have to state it, their date of birth, and so on. Okay, so those are some of the things that Joint Commission recommends, some of the guidelines. The other National Patient Safety Goal was about communication with the healthcare team members. Why? Well, because a lot of errors were occurring simply because we didn't communicate with other people. Either we didn't call in a critical value, a panic value, or we didn't communicate because we didn't find the patient, so we just, left. So communication between healthcare team members is another National Patient Safety Goals. And there's always new ways of improving, and Joint Commission is what they do. They go out there and they make sure that everybody's working at the highest level possible, where they call it, say, above and beyond, the regular standard. Okay, they help the facility become better by offering suggestions and guidelines. Okay, so it's really important that we follow them. You know, they're usually pretty good recommendations. Sometimes they go overboard, but again, it's not for our convenience, but for the safety of the patients. Okay, we are patients that sometimes we're on the receiving end, and we don't understand what's going on, but they do things like that because of Joint Commission or CLSI. Remember, CLSI is the pretty much the authority on in the lab functions, not just phlebotomy, but all lab function. Anything that happens in the lab is through CLSI. Okay, this is the agency that gives us, this is the Bible for the lab. Okay, anything they do is usually recommended by CLSI, including the venipuncture procedure, including the type of equipment, everything that you do is based on the guidelines from the CLSI. Now, the College of American Pathology, they deal more with the doctors. Okay, this is the agency that requires that every pathologist, have all their credentials in line, all their certifications in line, not just the doctors, but also the lab technicians that are in there. They go above and beyond and require more and more documentation, because if all the staff members in the lab are certified and accredited, and they have all the credentials in line in their employee files, that ensures the public that this facility has the best, most qualified individuals in the lab. So that increases the safety and perhaps, maybe even service of the staff. So you as a certified phlebotomist, are more better prepared than those that are perhaps have not gone through some kind of a training. What are HIPAA regulations? What is HIPAA? Insurance Portability and Accountability Act. It's a law that was passed back in 1996. And again, it's to protect the privacy of patients. So it is our job to ensure that no information is related to people that don't have any role. Okay, they have no business receiving information. If you're a patient at a hospital, and you're getting a procedure and you don't want anybody to know about it, your privacy is very important. So we are responsible to ensure that none of that information is getting talked about in public, including elevators, including cafeterias, and your neighbors and so on. You can't be discussing that kind of information. So your job again is to keep it very, very tight. Information. You cannot leave information about patients laying around where anybody can walk in and see it. That would be a violation of HIPAA, believe it or not. If somebody calls you from a doctor's office, supposedly a doctor's office, and they want results on the patient, and they give you a number, fax it over, email it, things like that, you have to make sure that you follow your facilities protocol as it relates to sharing information to outside people. Very, very important. How do the manufacturer recommendations for lab equipment relate to the phlebotomist? Well, if you ever have a question about a specific tube, right, you don't know how to handle, process a specimen, and you might want to say, well, let me ask this, this individual, this employee, they've been here, many years, they must know, and you get their information from them. The best source of information is the manufacturer's guidelines, right? Their documentation. That is where you get your information. Do not rely on personnel. We talked about quality control a little bit a while ago, and what it is, it's a plan. But this is the implementation of quality assurance. Quality assurance is a plan that you say, I am going to make sure that that my employees do not get needle sticks in this quarter because we're going to be doing A, B, C, D. All right, and okay, who's going to carry out A, B, C, D? Who's going to do it? Okay, well. Employees are going to make sure that all the equipment is up to date and that we have the best equipment, safest equipment for employees, and we're going to get them involved. Remember, you have to be involved in this development of the quality control plan. So quality assurance is the written plan. Quality control is actually doing what the plan is, okay, carrying out the plan, all right, and it's usually done by either performing inspections of the equipment, logging down the results of the equipment check, and so on. And it is part of your job. You got to maintain logs. You got to check, those reference ranges, troubleshoot equipment as needed if it's within your, your abilities, and so on. So you have to make sure that you follow these quality control measures. If not, you're not ensuring patient safety. Okay, by not checking the machines on a regular basis like you're supposed to, you're not ensuring the patient's safety. Okay, what are guidelines related to CLIA-waived test, and what are the phlebotomist's responsibilities of these tests? Okay, so what is CLIA? CLIA. CLIA is a law that was passed, I believe, in 1988. And this law was mainly passed because there was a bunch of labs that were doing things their way, and there was their way of doing things, and everybody thought everybody was doing the right thing. But when CLIA was passed, they kind of standardized a lot of things so that every lab was doing the same thing. Now, there are some tests that are very simple, that do not require, that have a very low margin for error. Okay, like for example, your pregnancy test. If you can do pregnancy tests at home, either you are or you're not pregnant, right? There's not a lot of room for error, versus a metabolic panel or some kind of test that is going to measure your functions. That would be very serious. If the results were incorrect, you could potentially get the wrong treatment and potentially die. So those are not wave tests. So again, clear wave tests are those that are that you can do in the home setting. Okay, you can do in the home setting, and they have a low margin of error. Okay, so what is your responsibility? Well, number one, you got to make sure that the test is not expired, that you know how to operate the machine, right? If you're going to do some kind of test on a machine, you have to know how to operate the machine. You need to know how to perform quality control tests on the machine. You need to know how to collect a specimen for the machine. Is it a capillary or is it a venous sample that the machine needs? Okay, so that's part of your job as a phlebotomist. Okay, know how to operate the machine, know how to do quality control, and know how to collect the specimen for the machine that you're using. Okay, these are tests that can be, they're called point of care testing. They're usually waived, CLIA waived tests. What are bloodborne pathogens? What is the bloodborne pathogen standard, and how does it affect the phlebotomy at work? The bloodborne pathogen standard, what it means is that the exposure to bloodborne pathogens, right? Any bacterial viruses that are living in the blood, it was put in force because employees were getting a lot of needle sticks. Okay, a lot of phlebotomists were getting, contracting infections because there was very minimal safety measures. For example, a lot of the needles that don't have the engineering controls. Okay, the risk of you getting punctured obviously is much higher. So this standard, okay, or forced employers to bring in or implement these engineering controls to minimize the risk of getting needle sticks. Okay, and after that, they brought something in called the Needle Stick Protection Act. Okay, they took it a step further, make it a law. So employers don't have a choice; they must offer the safest equipment for their employees. So remember, when you see engineering controls in the exam, it refers to safety features or devices. What are the requirements or responsibilities for phlebotomists as relate to biohazards? Okay, cleaning blood spills or disinfecting, etc. Well, your job is to know how to clean up a blood spill, right? Usually blood spills, you must have a kit, okay? A kit to clean up blood spills. Usually it looks like litter, right? Like cat litter. And if it's a blood or urine, you must contain that spill first, and you contain it by pouring this litter on the liquid, right? Whatever it is. If you drop the tube and it's spilling, you got to make sure that you contain it using this blood spill kit, and then you have to make sure that you use your industrial gloves, not regular gloves, and you scoop it up and you put it in a biohazard bag and dispose of it. So you have to be a little familiar. Now um, to disinfect areas of work like a countertop, okay, equipment, and so you got to use a uh, a a concentration of bleach. Okay, it's called sodium hypochlorite. Remember that word, sodium hypochlorite. What it is bleach. Okay, and you're going to use either a 1 to 10, right, concentration, which is for blood spills. Okay, if you're going to clean your countertop, you're going to use a concentration of 1 to 100, okay, which is less, it's not as strong as a 1 to 10. So you have to make sure that you will use the right amount of bleach to water. Let me see. Exposure control. Okay, what are the requirements for sharps disposal? Okay, what is a sharps container? Remember, these sharp containers have to be puncture proof. They got to have that one-way valve. They got to be placed in a lock unit, okay, where they can be taken out, and you can not fill it over 2/3 of the container. Usually they'll have a line. Okay, they have a line. That means that that thing has to be closed shut so that nobody puts in more stuff. A lot of people try to shake them down so that you can fit more in it. That's not recommended. You cannot put your hands in there. So they have to be puncture proof. They must have the biohazard symbol. Remember that black symbol with the orange background? They must have it. Otherwise, it's not considered a biohazard disposal. Water exposure controls. What do you do when you're exposed to a needle stick? Okay, how do you manage that? If you look on page 82, if you get a needle stick, usually you have to rinse for at least what, 30 seconds for a minute. Okay, always first aid first. If you see questions in the exam about what do you do first, you always give yourself first aid. You rinse the site for at least 30 seconds, and then you make an incident report, and usually they'll refer you for medical care or counseling as needed. Okay. What if you're um, if something splashes in your eyes? Okay. Number one, you gotta make sure you know where that eye washing station is. Okay. You gotta rinse your eyes at that station for at least 10 minutes. 10 minutes. What if you get exposed to a chemical, that may be toxic? You have to go to the shower station. You have to know where that is, and you have to be in there for at least 15 minutes. At least 15 minutes to wash the area, be an arm or wherever the spill may be. So look for those on page 82. What are standard precautions? Infection control. What are standard precautions? These are the precautions you take with everybody. You use gloves and wash your hands all the time. Remember, we're the ones that usually carry infections from room to room. So you take standard precautions by applying gloves, okay? When you're going to perform your venipuncture, washing your hands before and after, or using the hand sanitizers. Remember those hand sanitizers, gels or foams have to be used in the enough so that you're actually washing your hands. Okay, if you don't have running water, okay, you can use soap, okay, and then you can rinse your hands with hand sanitizer. Okay, this will take the place of the water. Transmission-based precautions are those that are passed through different routes, okay? Like airborne precautions, we know that tuberculosis is suspended in the air. The shingles are suspended in the air. So you have to wear your N95 mask, okay? You might, the N95, your gloves, of course, and you might require also a disposable gown. Droplet precautions require that you use a face shield. If somebody's coughing, talking, or whatever, a mouth covering. Okay, it doesn't have to be the N95, it can be just a regular mask. Okay, so know some of those bacteria that are passed on through droplet, like the flus. Um, there's other bacteria that are passed through droplet. Okay, it means they travel through the saliva. Contact precautions. Make sure you use gloves and a disposable gown. If you're going to be coming in contact with somebody that has a wound that is draining blood, you have to use a gown and gloves. If somebody has scabies, infection in the skin, or you suspect scabies, you have to make sure that you use gloves and a gown. So make sure that you're familiar with these kinds of precautions. Remember to also know how to put on and take off your gloves. That is one of the questions that I've seen before about putting on and taking off your gloves. So make sure that you are familiar with that. It's you can find it on page 72. Let me find the page number. All right. What PPE? What are what is PPE and when to use them, and in what order you put them on. 67 and 72. Okay, that's where it is. So PPE, again, is your gloves, your gown, your disposable shoe covers, a face shield. All that is considered personal protective equipment. Now, how do you put on and take off your gloves? So if you're going to put on or don gloves, okay, make sure it's always going to be your gown first, mask, and then the gloves. So gown, mask, and the gloves have to be fitting over the cuffs of the gown. If you're going to take off your PPE, make sure that you take off your gloves first. Remember to take off, pinch from the middle, glove to glove, and then skin to skin, okay? Be careful not to touch contaminated areas like your gown. Then after your gloves, it's going to be your gown. Remember, we take it off from the inside, making sure not to make contact with the outside because it's contaminated. Okay. And lastly, would be your mask or shield. Okay. So gloves, gown, and then your mask or face shield. What is the intent of hygiene guidelines? Well, the intent obviously is to minimize the risk of spreading infection. Very, very important. Okay. It can't be emphasized enough. You know, anywhere you go, there's strict policies about hand washing. And if you don't follow those guidelines, you can actually be written up for that. It's a simplest and easiest way to prevent the spread of infections. What is first aid and what must you check before initiating CPR? So there is questions about this on the exam, okay? And all it wants you to know is about shock. What is shock? When their body is going into shock, it means that it's shutting down, okay? So you have to recognize the symptoms of shock, and you can see them on page 93, okay? Pale, cold, clammy skin. Pale, cold, clammy skin, okay? The expressionless face is another sign, okay? But the most common one you're gonna see is pale, cold, and clammy skin. Clammy means like sticky, like sweaty, okay? This means that the patient is going to shock, okay? It could be because of infection, or it could be because whatever reason, okay? But their body is shutting down. So what do you do? What is the very first thing you do? So you must maintain an open airway. In other words, make sure the patient is breathing, all right? Because if they stop breathing, obviously your next step would be to perform CPR, okay? So make sure that they have an open airway, and then keep the victim lying down with the head lower than the rest of the body. Keep the victim warm. You want to keep the center part of the body warm because this brings more circulation, okay? So it's super important that you do that, okay? Maintain open airway. Keep the victim lying down with the head lower to keep circulation going back down to the brain and to the center of the body, and keep them warm. That's the only thing you do. Now, let's say they're still breathing, but then they stop breathing. You have to perform CPR. Remember that to perform CPR, the rate of compressions is between 100 to 120, and then the ratio of compressions to respirations is 30 to 2. This is for adults. Actually, the compression rate is the same for everybody, but you have to know about first aid, okay? Stay with the victims all the time. Do not leave them unattended, okay? All right. This ends the section on safety and compliance. We're going to move to the last section,